Hi, I'm Jody Pugh at doctorsofsouthwestflorida.com, here today with Dr. Barbara Reed. Dr. Reed is an orthodontist here in Naples, Florida. Dr. Reed, thanks for spending a couple of minutes with us.
Thank you for having me.
No problem. What I'd like to do, Dr. Reed, is just ask you a couple of questions about where you're from, how you ended up landing in Naples, and a little bit about your practice. So to start, you're not an original Southwest Floridian like many of us. Where are you from?
I am originally from Iowa. I grew up there in a small rural community and actually did my undergrad at University of Iowa.
Oh, okay. So you are Hawkeye, I think. And then after graduating from University of Iowa, you went on to dental school, probably somewhere. And where was that?
At University of Florida. Go Gators.
Go Noles. So upon graduating from dental school, because you're an orthodontist, you had to go through extra training to become an orthodontist, and that would be, I guess, a residency?
Yes, it is.
And you did your residency?
I actually practiced as a general dentist for 2 years, and then I decided I wanted to go back and specialize. So I applied, and I ended up doing my residency at University of Louisville in Kentucky, and it was a very good thing that I did.
Yeah. And University of Louisville, just so you know, that is in my hometown of Louisville, Kentucky. That's where I'm from. And so upon graduating from dental school, you went out and practiced for a couple of years and then decided, I think I want to go to orthodontic school. So a question, what made you decide that you wanted to get into orthodontics?
Well, I really felt like I wanted to get up every day and really love what I do. And I wasn't quite feeling that as a dentist, so I started talking to my colleagues, and I had an orthodontist friend that I would go to his office, and he really encouraged me, and it was the best advice that I ever have gotten in my life was to go back to school. And I did that, and it really makes a difference. I love what I do every day.
Yeah, we have a fantastic practice, a fantastic staff. Whenever I come here, it's always a lot of fun to see you. You definitely, for someone who also comes out of the dental industry, you definitely are a role model for how you run your practice, and it's very nice to come and learn from you and learn from your staff.
Well, thank you. I'm very proud of them.
Yeah. So how long have you been in Naples?
I moved to Naples in 2002. I actually lived in Fort Myers before, and I moved to Southwest Florida in 1998.
And then this practice has been here for how long?
2002.
Oh, okay, so you started this practice in 2002. Okay, great. And your practice is in Naples. We're just right off of Immokalee and 75 here. And when we think of orthodontics, sometimes we think about children and kids going through their braces and that whole thing, in which you do see lots of children. Tell me a little bit about what makes up your practice, though. I'm sure you see adults as well, and what are the different types of things that you see in your practice?
We do see a lot of children, teenagers, and adults. More and more these days, adults are seeking orthodontic treatment. So we offer that definitely. I would say maybe 20% of the practice now are adult patients, and we are very excited about that, and they get excited as well to have straight teeth that they really wanted all their lives.
Right. And I can tell you, as an adult, I think I was 27 or 28 when I had braces. And for my case, it was simply because I just had this desire to want to straighten my teeth, just an aesthetic type of thing for me. What is the majority of reasons that adults, whenever they do come to you for orthodontic treatment, what is the majority of the reason? Is it because they're having trouble, or is it because it's just aesthetics? What's the breakdown there of the adults who come to you?
It can be a combination. Most times it's because they do not like how their smile looks. Other times their dentist has recommended them to straighten their teeth for the health of their gum tissues and the bone around their teeth. So with orthodontics, we always strive for not only great aesthetics, but also function as well. So there might be an improvement in the bite that we need to do as well with that.
Right. And so typically, when an adult has braces, what's the average? I'm sure it differs. But what's the average amount of time that an adult may be in braces, or is that even a question that's you're able to answer? Is it vary so widely?
It ranges because it depends on the severity of each person. You know, sometimes they have a very simple request, maybe a single tooth that needs to be turned, which can be maybe around 6 months. But if they have bigger issues, a lot of crowding, rotations of their teeth, then it goes more into closer to the 18 and 24 month range.
Right. So let's shift gears a little bit and go back to the kids. I guess it makes up the other 80% of your practice. One of the questions that I have, because I have young children myself, is as I'm watching my kids grow and I'm kind of looking at their teeth, and I'm wondering if they are to possibly need braces, what age range do you typically see kids start to come into your practice, and give us a little bit of insight about that.
We typically like to start seeing kids around 7 years old. Not necessarily so that we're going to start orthodontic treatment, but we like to check their primary teeth to make sure that they have all of them. And we also like to check the adult teeth. We do take an x-ray to check that, but we can at that time guide some teeth into place if we need to, just monitor it. But by the time that they are ready for braces, they are already aware of the office, and they know us, and they're really comfortable as well. But there are a lot of things that we can prevent ahead of time if we see them early enough. Right.
Well, Dr. Reed, I'm glad that our audience has had a chance to get to see you, get to know you a little bit. I appreciate you giving us some time, and I encourage everyone, if you're seeing this video, you probably are on the doctorsofsouthwestflorida.com site, and you can see Dr. Reed's bio and profile, get a link to her website. If you want to learn more about orthodontics, you want to learn more about Dr. Reed, I encourage you to do that. Until next time, we'll see you.